Have you ever wondered if your healthcare truly focuses on you, the patient? It's time we take a closer look at a philosophy that's shifting the healthcare paradigm, known as patient-centered care. This approach isn't merely about administering medical treatments. It's about so much more. It's about understanding you as a person, your individual needs, your values, and your preferences. Imagine a healthcare system where your voice genuinely matters, where your comfort is a priority, where your values guide the treatment decisions, and where your feelings are respected and validated. It's about building a relationship, a partnership between you and your healthcare provider, founded on mutual trust and respect. It's about providing care that is respectful of and responsive to individual patient preferences, needs, and values. Imagine a healthcare system where you are not just a case number, but a unique individual with specific needs. Consider the story of Jane, a 68-year-old woman living with chronic heart disease. Jane's journey through the healthcare system was, for a long time, a tale of frustration and disappointment. She often felt like a cog in a machine, her personal needs and preferences largely dismissed in the rush of routine procedures and impersonal consultations. Jane's life was a series of appointments, tests, and treatments, dictated by a system that seemed to prioritize efficiency over empathy. Her voice was rarely heard, her values seldom respected. She felt sidelined in decisions about her own care, her personal insight into her condition largely ignored. This lack of patient-centered care had a significant impact on Jane's health and well-being. The disconnect between her and her healthcare providers led to a deterioration in her condition and a decline in her overall quality of life. She was more than just a patient with a heart condition. She was a woman with a life outside the hospital, a life that was being severely affected by her health. Then, Jane made a decision that would change her life. She switched to a healthcare provider that emphasized patient-centered care, a provider that saw Jane as a person, not just a case number. This was a healthcare provider that listened to Jane, that respected her values and preferences, and that involved her in the decision-making processes. With this new approach, Jane began to see improvements not just in her health, but in her overall quality of life. She felt heard and valued, her insights and preferences taken into account when deciding on treatments and care plans. The respect for her individual needs led to a more effective management of her condition and a renewed sense of control over her own health. This was a healthcare provider that didn't just treat Jane's heart, but cared for Jane as a whole person. They saw the woman behind the patient, the life behind the condition. They made Jane an active participant in her own healthcare journey, empowering her to take charge of her health and well-being. Jane's story is a testament to the power of patient-centered care. It's about seeing the person behind the patient and making them an active participant in their own healthcare journey. Patient-centered care is not just a philosophy, it's a necessity in our healthcare system. This approach places the individual at the heart of all decisions, ensuring that their unique needs, values, and preferences are respected and prioritized. It's about recognizing that healthcare is not a one-size-fits-all solution, but a tailored journey designed around each person. Let's recap what we've learned. Patient-centered care is not just about treating a disease or condition, it's about treating the person. It's about building a partnership between the patient and the healthcare provider to achieve the best possible health outcomes. This partnership leads to improved patient satisfaction, better health outcomes, and a more efficient healthcare system. Patient-centered care is about fostering relationships, understanding individual needs, and creating a healthcare journey that respects each person's unique circumstances and values. Remember, in a patient-centered care approach, you are more than just a patient. You are a partner in your healthcare journey.